As one walks throughout the streets of San Francisco, they may make many observations. The carefully crafted Victorian houses, the statuesque Golden Gate Bridge, or the sprawling bay with sailboats drifting by. Yet, among these sights, they will most likely also encounter individuals experiencing homelessness. San Francisco does not stand alone in this coexistence. Homelessness has become an integral and prevalent issue in many cities and towns across America. Amongst the unhoused, there are often evident mental health struggles. Many wonder when much of America turn their backs on the mentally ill, and why there is no place for so many of them to receive the support they so desperately need. Let's go back to the beginning. In the past, people with mental illness were often cast out of their homes and communities, and without support died young. Due to the mentally ill often having no place to go, with families that could not support them, mental asylums were born. The creation of these asylums resulted from the desire for increased public hygiene, as well as a shift in belief that mental illness was not the result of punishment from higher power, rather a health condition. Though mental asylums could often have harmful conditions for their patients, they were an effort to support the mentally ill. The Quakers in Philadelphia were the first in America to make an organized effort to care for the mentally ill. By 1980, almost every state had one or more publicly supported mental hospitals. We ask again, how did it get so bad? Many believe that the present plight of the homeless is because of the 1980s policy to reduce and deinstitutionalize mental health facilities. The courts also placed stringent restrictions on involuntary admissions to institutions. Ronald Reagan was elected California governor in 1967. One of Reagan's major campaign pledges had been that he would bring economy to state governments and end years of Democratic looting of the state treasury. Shortly after taking office in January 1967, Reagan announced plans to reduce spending for most state programs by about 10%. Reagan, like many others at the time, believed that the mental health institutions were a means of stealing state money. In believing this, he created an association with the mental health facilities and more liberal policies. This furthered the notion that mental health facilities seeking to aid the mentally ill was an inherently democratic act. According to Jones, several prominent California psychiatrists have suggested that Reagan's budget cuts constituted an ideological attack on the mental health movement, consistent with the right-wing view that mental health is a communist plot to brainwash Americans. This attitude regarding mental health contributed to the ideology that it was necessary to defund mental health institutions. This, in turn, went beyond matters of fiscal policy and became more ideologically motivated. Reagan's words were not empty threats. During his governance, the Reagan administration announced the staff of Department of Mental Health would be reduced by about 3,700 positions, roughly 1/6 of the department's total personnel. Over a 15-month period, 15 treatment day centers, aftercare clinics, and other state-operated facilities would be closed in advance of previously announced phasing plans. This forced many institutions to close and many mentally ill to be on the streets. When elected president in 1980, Reagan furthered his plans. He believed in reducing the government's involvement in the lives of citizens, often complaining against the welfare state with getting the government off the backs of the people, with the slogan, "Government is the problem, not the solution," and therefore cut federal funding of national mental health institutions. However, when he received backlash, he allocated grants to the states to spend as they deemed fit. The catchphrase and supporting rhetoric was that the money would follow the patients, but unfortunately, the states ultimately utilized the money for other purposes. In reality, all that was happening was money and funding was being removed from the vulnerable populations being housed by the institutions and the institutions themselves. The deinstitutionalization of mentally ill individuals led to devastating consequences for both individuals affected and society as a whole. With the reduced funding came the subsequent closure of mental health facilities, releasing many patients. Many were left with nowhere to turn after this, unable to access medications necessary to manage their mental health conditions, and without shelter. This forced many into dangerous situations, leading to prison, further deteriorating further deteriorating their already fragile mental health. However, there are resources in place. In San Francisco specifically, there are several associations working to treat the mentally ill. The Substance Abuse and Mental Health Services Administration, or SAMHSA, is one of the leading federal agencies addressing the issue of housing stability for individuals with serious mental illness. The nonprofit St. Anthony's is one in the Tenderloin District and also provides basic needs for the needy as well as mental health services. Although the crisis can seem grim, there are many different individuals and groups working to help those who need it.